A very warm welcome to everyone who's joining in. We see the participant list increasing, which is excellent. And so we'll give it a couple of minutes until we see it stabilize, really. So let's give it 1 or 2 minutes. Okay, so I've seen our list of participants stabilize, and I'm pretty sure that many others will join in as you tweet and as you share notifications about this webinar. I am Shakira. It's a pleasure to be moderating today's session on behalf of GMP Plus and EPIC. Thank you all for joining us from wherever you are in the world. In fact, to get us started, we have 2 poll questions which will pop up on your screen. It would be great if you just click one of the boxes. So we're going to have the first poll come up, which asks, where are you joining us from today? So do go ahead and click that on the screen. I'll get started in the meantime. I'm currently the thematic lead on the Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights. Again, I do see the poll question come up, so you're welcome to add your response in there. As I continue speaking, it would be great to hear where you're from and what sort of work do you do as well. As I mentioned, I work on the Generation Equality Action Coalition, and this brings together 300 plus partners from all across the world who have committed to sexual and reproductive health and rights on various fronts. On behalf of GMP Plus and EPIC, we're going to be discussing and delving into the topic of pediatric HIV and climate change. Now, this is quite interesting for various reasons. And before I go ahead, if possible, if we can show the answers of the poll, that would be great. If not, I don't trust technology that much. We'll continue. Okay. So if it's possible to see the answers, we will project it on screen. If not, I will continue. And basically, getting into really the heart of today's discussion, we're joined by a great list of panelists. We know that GMP Plus works quite a bit on supporting people living with HIV, championing people living with HIV's agenda, increasing access to treatment, making sure people who live with HIV are in key decision-making spaces, and are high on the global, regional, and local level agenda. We're also partnering today with EPIC and Paediatric AIDS in children. And together, really, GMP Plus and EPIC work quite work quite hard front and center in terms of championing access to quality HIV treatment for children living with HIV from the time that they're born until the time that they're 14 years old. In line with today's discussion, there's a couple of important statistics I'd like to remind us all, because I think many of us who are joining today, and that brings me to the second poll for today, is really what some of the areas that you're working on. The poll will come up on your screen, and you're welcome to type in or click as this appears on your screen. And so really jumping into why we're having this discussion and reminding us of the key statistics. Again, I'm anticipating that many of you know this and know this well. We know that new infections among children aged 0 to 14 years has fallen by 75% between the year 2000 and 2022. But in the last 5 years, we know that progress has also stagnated. 42% of vertical HIV transmission occurred during breastfeeding in 2022. So this shows us the different parts of the HIV epidemic among children that we need to consider. We also know that 57% of children are still accessing treatment. So this is quite far off the 90 or 1995 marks that the global or the world has really set. And finally, we'll kick off this discussion, importantly reminding ourselves that every 6 minutes, we lose a child globally because of mortality due to HIV and AIDS. We're going to then center this discussion around, yes, this is the burden of HIV among children. This is the types of treatment, but contextualizing it within a changing world. And when we talk about a changing world, really, it's really thinking about, yes, there are economic changes, but there are also, severe changes in our climate. And what does this mean for the world's vulnerable populations? And that is people living with HIV, and even beyond that, children who are living with HIV. When we think about climate disasters and climate responses, we know that HIV is clearly centered within food insecurity, migration, and so this really contributes as well to increased vulnerability. We also know that women, specifically in Africa, and young women, bear the burden of HIV, with looking at around, quite high statistics, and double the burden of HIV among young women. So within climate disasters, it heightens gender inequalities, and we know that this underpins HIV. So I've said quite a lot. The chat box is, again, your space, a respectful space for you to weigh in. We will be posting questions throughout. Share your thoughts, share your excitement, share your ideas, share your actions as well. And on that note, I'd like to kick us off with our first speaker of the day to welcome us. And we've got Florence, Riako, Anam, who's the co-executive director of the Global Network of People Living with HIV, GMP+. As I mentioned, this webinar is hosted by GMP+ and APIC. And so, Florence, we're going to have you really kick off this first segment of this webinar around the linkage and interrogating that linkage between HIV among children and climate change as an emerging threat, but also an emerging priority. So could you tell us a little bit more around, one, this emerging link, and two, where you see GMP+ playing a role in this? So over to you.
Indeed, Shakira. And first, I think I would love to welcome everyone to this webinar. It's the first time that GNP+, as the global network of people living with HIV, is taking a leap into the conversation around climate change, and doing it on a population that largely always remains unnoticed and usually gets forgotten: children. I just want to start by indicating why this is also important for GNP+. We envision a world where all people living with HIV enjoy their right to a healthy and dignified life, free from stigma and discrimination, and are committed constantly to providing that global leadership and advocate for people living with HIV. And so therefore, it goes without saying that advocacy is the backbone of our work. And so we are centered around seeing, particularly within the global health governance spaces, the realities of how HIV intersects with many things, and the reality of how the broader health governance or architecture is burdened by so many other health and social development issues, for which climate change is one of them. I also just want to acknowledge that EPIC, which is short for End Pediatric AIDS in Children, is an initiative that is a collaboration between GNP+ and our partners AIDS Funds. It commissions and focuses mostly on ensuring community-led advocacy at the global level for children. So it's one of our work that is primarily for children. We execute this because we know that it matters that our own stories are told. The initiative focuses on advocating for access to treatment and healthy, productive lives for children aged between 0 and 14 years old. But we involve parent advocates and build their capacity and offer the opportunities for them to come and do this from their lived realities and stories. So currently working with 31 Mama and Papa Bears, which is who we call them, from 7 countries. So I think we can have this discussion in various ways, but they will largely be centered around the experiences of parents who care for children and caregivers who care for children. So how has climate change and HIV and AIDS impact children, or what are the evolving or emerging threats? And I think I'll cover this in various ways by looking at where we are with the HIV progress, first of all. We know, thanks to the HIV science, we've made remarkable changes and shifted the landscape of the HIV response. In the last decade, particularly, we've seen a reduced number of HIV infections. Many people are on ART, so that has significantly reduced AIDS-related deaths and improved quality of life for people living with HIV across the world. And our life expectancy too. Many of us were told we would be dead by in 7 years or in 10 years, but we are here. So this is all because of the science, but we can't negate the movement, the incredible contribution of community and civil society, and that strengthening of the civic space to influence policy with data, with information, with lived realities, but with practically being consistent about shaping policy, working with our governments, with policymakers, etc., to ensure that policy programs that are being implemented, service delivery works for people living with HIV. However, despite this progress, we don't see the same progress in children. You've mentioned some of the data that are children specific, and I won't go into much of it, but it's really a concern that 4 in 10 children, or rather infants, missed out on timely diagnosis in 2022. If you're not diagnosed, you will not be put on treatment early. And we lost 84,000 children to AIDS-related deaths from diseases that are largely preventable. They have diagnostic equipment, they have cure, and they have prevention modalities. So I feel like this is the highest form of injustice. It's robbing children of their future. And that doesn't disappear much when you look at the effects and the impact of climate change. We are facing that impact now, or we are beginning to face the impact, but if we don't mitigate what needs to be mitigated, that impact would affect the future of the next generation. And so it is important that we center children in all of the conversations we are having. There's a lot of lessons that HIV has around movement building, but also around our experiences responding to COVID, for example, and other epidemics. And also where there's conflict or anything that has predominantly threatened access to treatment. And there are lessons that can be taken into broader conversations. But I think we have to make sure that we center children because they continue to face the harshest impact of inequalities, life disruptions, diseases. My country is one of the places where we are currently facing effects, if I may, of climate change with persistent flooding and schools now getting closed for indefinite amount of period. So there will be children not going to school, and that already is an injustice. So why should we focus on children? I was told to answer to this specific question, and after reflecting on it, I think it's because I believe children are our future. I truly believe in the greatest love of all, as sung by Whitney Houston. And I hope that after this webinar and going beyond, we are all inspired to do our bit today for the benefit of children living with and impacted by HIV so that they can be able to thrive and live their full productive lives. And welcome you all again here. And thank you so much for this discussion. Back to you, Shakira.
Yeah, thanks so much, Florence, for, really kicking us off. You've said a couple of things, and a couple of things have sort of stood out for me. The one is thinking about within the global governance architecture, where do we place this really? You've then spoken it around the role of parents and focusing on parents and caregivers, and then also thinking a little bit about strengthening civil society space. So you're really getting us to think about what are the actions beyond just what are the linkages. And I think that's important. Of course, many of us in the health discussion and many of us in the HIV field are now coming to what are existing climate decisions. And so what are we taking to the table is something for us to think about in this webinar, and really, again, going back to the evidence, thinking about what are the issues we want to raise and we want to position globally, but in key climate spaces, and bringing it together in health spaces as well. I'm going to shift to Gloria Nawanyaga, who's a really powerful youth activist from Uganda. Gloria is an activist for HIV, for sexual and reproductive health and rights, for gender equality, and she does so much, if she is the correct pronoun, on the ground level, working directly with young people, working directly with children. Gloria, I'm going to turn to you. When we're talking about pediatric HIV and we're talking about climate change, what's coming out from the ground level? Are there any happenings in Uganda? Are there any happenings across the African continent where we see climate disasters? For example, Mozambique, for example, Malawi, if, of course, you know, you're in tune to any of these experiences from the ground level as well. So back to you on the Uganda situation and any other setting that you feel comfortable sharing about.
Thank you so much, Shakira. Good afternoon, good morning, and good evening, everyone. Shakira has introduced myself, so I'm going to introduce myself. I'll go straight away to the question. And I think this is the right time for us to talk about climate change and its effects on health and children, to be specific. We have seen so many effects, and we have seen that climate change has actually really affected us. And I'm glad Florence has given a very, very good example in her country. And of course, we are seeing this even around the world, just like Shakira said, Mozambique, Dubai, everywhere, that climate change effects are really affecting these people. Talk about floodings, talking about, you know, the tsunamis and all that. And at the end of the day, this still comes back to children. And we're seeing that due to different climate change effects, for example, if we have floodings, trust me, there will be problems of nutrition. We will not have food. And at the end of the day, children will not be able to take medication when they don't have enough food. Let's talk about access to treatment, access to HIV services. If we have all these different climate change effects, for example, flooding, drought, and all those other instances, children will not be able, and caretakers as well, will not be able to access proper treatment and HIV services. And at the end of the day, will not be able to achieve our target of ending AIDS in children by 2030. As Florence has said, she has given some statistics, and I can also add to her voice and say we have over 2 million, approximately 2 million children living with HIV globally. And in Uganda here, we are looking for 10,000, over 10,000 young children who are not on treatment. And we believe that why they are not on treatment is because of some of these climate change effects. Number one, displacement. When we talk about climate change effects, just like I said earlier, flooding, of course, when floods come, people will run away. And when people run away, that means definitely they will not stay on treatment, or even fail to access treatment, or even the HIV services. So I believe that all the climate change effects that we're talking about zero down to affecting children, affecting treatment, affecting HIV response at large. And I also believe that we as advocates in the HIV sector have not really done enough in integration of climate change and HIV advocacy. And I believe that they all work hand in hand. When we talk about health, that is SDG 3, and we talk about climate change, and talk about all the other SDGs, you see that they all zero down to climate change. Let's talk about SDG 3, which is no hunger. Talking about SDG 6, 5, 7, 8, 9, 10, up to 13, all zero down to climate change. And we have actually lost our voice when it comes to climate change as we HIV advocates. And just like Florence has said earlier, she said that, if I quoted her right, that this is one of the first initial conversations on climate change. We have not really given this priority, yet it is actually affecting our work. We cannot ignore climate change, especially in this time that we are seeing so many effects when it comes to flooding, when it comes to drought, when it comes to, people being displaced around the world. And at the end of the day, these are affecting our children. When children don't get treatment, will not achieve our goal. When children don't have food, they will not adhere to their medication. When children are misplaced and their caregivers and guardians, they will not be able to, be in harmony at the same time, take medication. So I believe this is the right time to talk about climate change, and I believe this is the right time to integrate advocacy of climate change and HIV, but also service delivery. And I believe that we should empower our populations, starting from the caregivers who are with these children and the children as well. We should empower them to see that they can actually have enough information on HIV, but also climate change and how best they can contribute to a better climate. I personally, I was glad that I did environmental law, and I understand that there are so many people out there who are actually doing so many things that are affecting our environment. For example, deforestation, the fossil oils we are seeing right now, and so many people are not doing something about it. We should empower our caregivers. We should empower our children on how best they can preserve the environment, like starting with small things like planting trees, starting with small things like, having avoiding building in swamps and all that. So we should empower our communities, but also educate them at the same time, and also give them the skills they need by equipping them with the skills to be able to contribute to the environment. And of course, at the end of the day, we'll be able to help them adhere to their medication, and also live in a quality life and dignified, just like Florence said. Back to you, Shakira.
Yeah, thanks, Gloria. It's always like when I introduced you, I said, you're quite a powerful person, but a powerful speaker as well. And so, thank you for your intervention. But you also got me thinking of two things. The alignment between youth activism in the climate space, which is ongoing, which is actually exceptional in my personal opinion, where we see youth activists across the world stand up to climate change, and actually those who are even in the much younger echelon of youth, so 15, 16 years onwards. And so children themselves or adolescents themselves are also taking up this agenda. How do we start to draw parallels between, and this is for the broader webinar, of course, let's think about how do we draw parallels between youth activism in the climate space, youth activism in the HIV and sexual and reproductive health space as well. The second thing which had come to mind as Gloria has spoken was thinking around, I love it when I lose my train of thought, and yeah, I am moderating. But the second thing which had come to mind is, how do we measure, or are we measuring, the impact of climate change on sexual and reproductive health, and also children and people living with HIV? And I think this is quite a new and emerging area. We're probably not doing it yet, or not to the extent we're meant to. We're seeing too little rainfall in some places, the impact of drought on what's already happening. We're seeing too much rainfall in some places, the impact of flooding on health facilities, for example. What does this mean for treatment for HIV? Again, other contexts on the African continent include South Africa, which has also been seeing high levels of rain, high levels of flooding in Kenya recently as well. So again, are we measuring the actual, impact of climate change on people and children living with HIV, and women and girls as well? So as we go through the webinar, I want to again encourage you to use the chat box. If anything stands out for you, if you're interested in anything, I see a couple of well-known HIV activists who've joined us as well. So Prosper and Glovu and Gloria Chamaga as well. So really the chat box is your space. To the panelists, there's a question in the chat Q&A section already, so you're welcome to respond to that as well. And we're now going to shift our next speaker, which is Corinna, and I'm hoping I get your surname correctly, Corinna Csaky, who's from the Coalition of Children Affected by AIDS. Corinna, you've got such an impressive profile. You've worked for the past 20 years on, children's rights, the health rights of children through various organizations. You've also worked with children who are affected by HIV and AIDS, which you reminded many of us through your bio as well. And so again, yes, we're not measuring as much as we should be. It's a new and emerging area, But based on current data, or current evidence, again, what's that impact? You know, if we were to sum it up in 4 or 5 key broad areas, what's the impact of climate change on children living with HIV?
Thank you. Can you all hear me okay? Can everyone hear me? Yeah,
We
great.
can hear you.
Okay. Thank you, Shakira, and thank you, Gloria and Florence. What an amazing start. I'm really inspired by your words, and I agree with many of them, and they're making me think of all sorts of avenues that the coalition can take to champion this issue further. So it's an honor to be amongst this wonderful panel and to be speaking with you in the audience. I'm here on behalf of 28 UN, donor, NGO and academic representatives, and together we're the Coalition for Children Affected by AIDS. I can see some of our members in the audience. Florence Anam is one of our members from GMP+, and we're part of EPIC. And our goal is to secure better global policy and funding for children and adolescents affected by HIV. So thank you very much for inviting me to be on this panel. I want to start by highlighting that we at the Coalition are at the very beginning of our learning journey, and I come today with reflections rather than answers, and an invitation to all of you for us to work together more on this critical topic. There are 3 reflections that our members have advised me on. So firstly, as some of you have alluded to, we really must step up our advocacy outside the HIV sector. We must be advocating more to international humanitarian and development actors outside of the HIV sector so that they prioritize HIV-affected children and adolescents as they seek to address the climate crisis. The second reflection is that, as Shakira has mentioned, we must build the capacity of child and adolescent HIV activists in the climate space. And I want to talk more about that later on, but I think that's such an important part of our work. And thirdly, we must build the evidence base, both on how to prevent and how to mitigate the impact of the climate crisis so that we have a foundation for programming and for advocacy. And just quickly in response to your question around evidence, I mean, as a starting point, every analysis of climate impact should be disaggregated according to HIV factors so that we can understand the evidence and how it relates specifically to HIV. I mean, that would be step 1 at very least. I won't go into the detail of the links between children, HIV and climate change. Gloria and Florence have summarized it so beautifully. Just a couple of additional reflections. One of our members, Repsi, took me on my own personal learning journey in Zimbabwe to understand the impact of climate change on children already impacted by HIV. And on top of all the issues that Gloria and Florence have mentioned, they also showed how children are more vulnerable to child marriage, transactional sex, that there's been a sharp rise in adolescent pregnancy and inadequate care, substance abuse, more girls and young women facing violence as they walk further to fetch water. And the list goes on, but there were 2 that Repsi were very keen to highlight in all of the consequences for children. One is that more girls and young women are missing out, more girls especially, and children more broadly are missing out on school. And as we all know, school is our greatest vaccine against HIV, and that is a travesty. And secondly, mental health. Mental health is a critical issue, and we all know about the depression and suicidal ideation that accompanies child HIV and adolescent pregnancy, and that this is being made worse by climate-related mental health conditions, particularly eco-anxiety and depression and PTSD. I'm just thinking about those children and adolescents today in Kenya and the extreme weather events they've experienced this week and the trauma they are experiencing, and how many of those with pre-existing HIV-related mental health conditions and the combination of those impacting on them. So REPSI, as many of you know, work in 13 countries in Eastern and Southern Africa. And I just wanted to share some of the solutions, because I do think it's important to think about, to be positive and think about what are we all doing already and how can we learn from and build upon that. So REPSI in Zimbabwe supports young mothers to share and address the challenges they face in peer groups and to access frontline services. They also work on national policy, and they build the capacity of families and frontline providers to recognize the warning signs of child depression related to climate change. And they are at the same time alleviating the practical and psychological stresses of climate change on children by teaching them all sorts of practical skills: how to harvest water, how to plant trees, how to grow their own food, how to reuse, recycle, reduce. And I think most critically of all, how to be climate activists in their communities. And this is making a practical difference to their lives, but also helping them cope and thrive in such difficult circumstances. So it has psychosocial benefits as well. And they have seen that suicidal ideation amongst young mothers has decreased from 35 to 9% in this last year alone. So I'm sure all of you at this webinar will have your own examples of supporting HIV-affected children and adolescents in the climate crisis. And I'm really excited to hear more about them. And I hope later on in the webinar, we can go on to talk about what else we can all do. But I'll submit there.
Thank you so much, Corinna. And I think you put it pretty succinctly. You also got me thinking a little bit about you know, something that you said which stood out to me was building the evidence for the foundation for programming and advocacy. That's absolutely critical and important. And two other elements you brought out in this webinar, which has not really been spoken about, and I think it's critically important. And the one is eco-anxiety and the need to protect our children, create safe and enabling environments. What does that mean for children as well? And then also thinking around the mental health. So, you know, really some interesting elements that you brought to the fore in this webinar. I see in the chat box that we have one of the participants, Charles, who's posted as well. And Charles has said that, like for Malawi, a lot of children and youth are experiencing challenges due to Cyclone Freddy. And, you know, Charles was also wondering, it's not that it's once off, it's that these implications are so long-term. And the effects of Cyclone Freddy are still probably there and probably exacerbated over time. When I think about roads in South Africa and KwaZulu-Natal, due to climate disasters, they've still not been fixed 1 or 2 years on. And so I wonder if that's the case in Malawi as well. Charles has essentially posted that, you know, some of the on-the-ground impacts we're seeing is issues with changes to medication, safe water. That's quite critical to the climate and HIV discussion. Girls not having access to menstrual pads as well. So for those of you, and you know, I realize that many of you, other than being HIV activists, many of you are also people living with HIV. And you know, you're welcome to start to share your thoughts, because it's not just about children, but it's about thinking collectively through these experiences and how they're actually amplified among children. Many of them are not quite different, but there are cases where they're quite distinct. Many of our panelists have spoken about the disruption to schooling. That's another key theme which is emerging from this discussion. So again, if you've just joined us, or if you're still joining us, thank you for being here. This webinar is organized by GMP Plus and EPIC. And we're focusing, as you've heard from multiple panelists as well as myself, on pediatric HIV and climate change. We have 2 more panelists to go and to offer really their interventions. The next is Onesmus Kalama, and Onesmus has worked or is working as a public health practitioner, but he's also previously led the regional network EANNASO And Onesmus actually had the opportunity to visit EANNASO a few years ago. So it was great to see that in your bio as well. I do know that in this webinar, it is global, but we're starting to see threads of the African context emerging quite a bit. We also know that women and girls, specifically in the African continent, bear the burden of HIV. And so over to you, thinking around the African context where you've lived and worked for most of your life and you continue to work, what are some of the trends that you're seeing emerging? Are our governments considering this link, if at all? And if not, how do we start to put this on the agenda? So again, over to you to take us through the topic, the African context, and where and how we can put this on the agenda if it's not already there.
Thank you very much, Shakira, and I think this is a very worth topic of discussion at this particular time, when actually the agenda on ending pediatric AIDS is really taking a very strong root, especially in the African continent. And I really just want to do a quick throwback into last February 2023, when African leadership met in Dar es Salaam, Tanzania, and came up with the Dar es Salaam Declaration on ending pediatric AIDS by 2030. And this was quite a commendable, and like you're saying, Shakira, is it an agenda? Are people thinking about it? And I think this is one step that is extremely positive, that we have the top leadership of Africa coming together and actually thinking or committing to end pediatric AIDS by 2030. Yet, the realities may actually be speaking different. This is a very high-level political declaration, and the declaration came up with very clear approaches on what needed to be done to end pediatric AIDS by 2030. There were 4 core pillars that were mainly focusing on testing, early testing and optimal treatment and care for infants, for instance. That's something that needed to be done. Like just one of my co-speakers said, if you are not tested, then you are likely not to be put onto treatment. So actually early treatment, early testing is essential to ensure that we have children and adolescents actually put into early treatment. But again, there was the whole issue of closing the treatment gap for pregnant and breastfeeding women, leaving the HIV to eliminate vertical transmission. This is something actually that needs to happen if we are to think of ending pediatric AIDS by 2030. And then there was also preventing new HIV infections among pregnant and breastfeeding women and adolescent girls and women. And someone actually talked about issues of nutrition here and the lack of food. And this impacts very, very strongly, especially on women living with HIV and AIDS who are actually breastfeeding in times of dire stress for food. Actually, this could actually increase transmission of HIV to infants. But of course, there is the whole big issue of addressing rights and gender equity and social and structural barriers that hinder access to services. It's really a very clear approach that was determined to actually end pediatric AIDS by 2030. But then we are actually talking climate change here. How does it impact on these core areas that have actually been identified as the core areas to end pediatric AIDS? And allow me to bring an angle here that which probably has not been spoken quite a lot. With climate change comes what you call increased multi-disease burden. And what does this mean? The world is getting warmer, and we are beginning to see some of the transmissible diseases or tropical diseases, including malaria, actually moving from lower grounds to higher grounds that malaria was non-existent. The Anopheles mosquito is finding actually a new neighborhood in higher grounds that were quite cold for it to exist. Now it's existing very comfortably. And you can just only imagine the immune system of children who is still very not so strong, who are already probably infected, and then they also get malaria. This is actually a catastrophe. And this is the reality of climate change. The world is getting warmer, and we are beginning to see some tropical diseases or some diseases that were mainly the preserve of probably warmer areas extending to colder areas that were actually kind of safe grounds. We have seen it in countries like Kenya, where we have the highland malaria now beginning to become a reality in areas that was not there before. So this is quite a critical challenge that actually requires a very pragmatic approach to ensure that we do not actually start seeing the extra burden of diseases actually impacting on our children. Someone talked about food security. It is something that we cannot actually wish away. I'm one of the farmers who lost probably 10 acres of edible crop because of flooding in the area I was farming. I mean, and I wasn't only the only one. Many people lost their crop. Actually, in areas that it never rained, it rains somewhere else in higher grounds, and the water comes in its tons and millions of liters and floods all arable land. And people have lost a lot of food crop. And this is an extremely bad indicator for health, especially for women and children who are infected, because there are going to be trade-offs here. Will people use the little money that they have to go look for healthcare, or will they use this little money to look for food that they can actually be able to put food on the table? And when you have to make these trade-offs, most likely people are going to buy food instead of probably using this small money to get into some public transport, move into some place where you're going to look for a medical care. I mean, when these trade-offs come in, then it actually increases the risk of HIV and probably mortality among children who become the extreme victims. Let's talk about infrastructure. The pictures we have seen in countries like Tanzania and Kenya is just extreme devastation. The road networks have been washed away. As hospitals, schools have been flooded. Now, the only places where people probably never used to go to get their ARVs have been flooded. That clinic is closed, or that dispensary is closed. Now someone has to think of where is the next dispensary that we are supposed to go to get our ARVs. We have actually not had in this very short time where we have medical emergencies, where temporary camps for ARV distribution, for instance, have been set up. They have not been set up. So what does this mean? People have been left to actually look for their other alternatives to actually replenish their ARVs. So these are the realities of climate change that are really actually impacting on our women and more so children. And besides, when climate change consequences or catastrophes hit, there is increased migration. We all know what happens with increased migration. It actually just only widens the enlargement of extension of new sexual networks. This basically happens, and this increases actually HIV infections. So these are the realities we are dealing with climate change. And just probably to conclude, what probably do we need to do then to ensure that we make the African agenda on ending pediatric AIDS a reality? Probably it's time to foster a women-led response on ending AIDS in children. Women bear the burden, they are the caregivers, and if we actually put women on the table of decision-making and actually planning to end pediatric AIDS, I think we'll be on the right step. Let's ensure that the African agenda to end pediatric AIDS becomes a reality by intentionally holding ourselves, not just other people, but ourselves, governments, and all other partners accountable for results. Shakira, you talked about results. It's time we start actually looking for those results. Let's end inequalities. Climate catastrophes thrive where inequalities persist. And if you look at the most hit people, when climate catastrophes hit, they are actually the most marginalized members of our communities. And finally, let's integrate climate change in the design of all our pediatric HIV programs at all levels. Thank you very much.
Thanks, Onesmus. You've really brought this conversation, I believe, to different points that we need to consider, because we started off saying that we've not spoken about it a lot, but I think this webinar is already so rich and starting to show us that there are so many intersections already. A few things which you said, which really jumped out at me was, the words of devastation in countries like Tanzania and Kenya. And this devastation really meaning economic implications or impacts economically. And so that's also something which contributes to additional vulnerability, which underpins the HIV burden, as we know. You've then spoken quite aptly about malaria and the continent facing high levels of malaria transmission in tandem to other other conditions such as HIV. And so thinking around the whole health system, multiple types of infections that we have, transmissions that we have, and all of this being affected through climate change is important. As we sort of shift ahead, a reminder that we have around 4,000 young women and girls who are infected almost every minute, I believe, of HIV on the African continent. And so that's something for us to also keep at the back of our mind, is the gender inequalities that are shaping the HIV burden on the continent. As we move ahead, I started off saying that, yes, we said we haven't done that much, but actually we're seeing quite a bit in the chat box as well. We had a comment around community health promoters. So it's worth thinking through, what are the different arms of the work that we're doing? And Onesmus spoke to it, how do we integrate within the programs that we're implementing as well, within the different parts of the system we're working with, the different health personnel as well, what is their role within all of this? So that's something to think about. As we're beginning to move towards our final panelists and then closing remarks, I would encourage many of you to post your questions in the chat box, or your thoughts as well. To the panelists, we have two great questions in the chat box. The one is from Stuart Keane, and Stuart asks, it would be good to hear about examples of peer support groups for adolescents living with HIV in terms of tackling psychological aspects such as eco-anxiety. So thanks for that question, Stuart. I think it's a really great one. And then Grace has posted not so much a question, but rather concern, where Grace says that, in Pilo Hospital, where Grace had done the research, and I'm not sure what type of research, but Grace basically says that when it comes to adolescents in the clinics, there was an absence of caregivers and children. So our esteemed panelists, as we start to close off, think about these questions and we'll come back to them. We're going to shift to our final speaker of today, who's been waiting very patiently on the line, but who we've also been waiting very patiently to hear from. Jackline Kiarie, you've got a master's in public health. You're involved as an observer, I believe, at the Pandemic Fund, but you're also a regional program manager for Amref Health Africa. And Amref Health Africa has launched their strategy in, I think, the past few months. And I was at the IHEC conference where I heard that the Amref strategy sort of focuses solely on bringing together health and climate change and responses as well. Amref also works quite strongly in key climate organizations or climate convening, such as COP28, COP29. And so it would be really interesting to hear from you as an expert on global health governance, on public health/global health. We started off with this question, actually, or the statement. Florence had said, GMP Plus is interested in global governance. What does it mean for pediatric HIV and climate change? And so we end off this first segment of our panel discussion with you. What are some of the lessons that you can offer in terms of some of the work you're doing on pandemic responses, and these emerging discussions that we're having on HIV and pediatric HIV and climate change.
Thank you so much for the kind words, and I appreciate all the panelists. I think it's a learning session for me too, because I'm not too much in the HIV space, so really appreciating this conversation. I'm in the health security space, and under the health security space, most of what we are dealing with is disease outbreaks, how to prevent them, how to control them when they happen, how to ensure our communities are ready. So really great to have this discussion that is looking at the intersection of, the health security pieces, the climate change that is driving some of the health security issues we are dealing with, as well as the childhood HIV programs, which is very important because HIV is obviously one of the pandemics that we are dealing with. Having said that, I think Africa is one of those places that has become the epicenter of infectious diseases. I think for the first quarter, for example, over 60 had been reported on the continent. And what that means is that we have competing priorities on the region. We really want to be able to handle the outbreaks as soon as they happen, but we also have all these health issues we have to handle on the continent with the meager resources. So planning becomes very critical, proper governance becomes very critical. We are seeing changing disease dynamics, and I know Onesmus has already alluded to that. But what is unique is that some of these diseases that previously affected adults, such as monkeypox, we are seeing more and more numbers of children reporting such diseases, under 5s especially, in 11 countries where monkeypox is endemic. We are seeing the same trends with cholera, for example, that mainly affects under 5s. And in the region, we've had quite a number of countries that are dealing with cholera, and we don't know what is going to happen, especially in countries like Kenya that, recorded their last cases very early in the year, but now we have heavy rains. We are likely to have cases of cholera again. So this intersection between all the crises we have to handle on an ongoing basis and looking at how that impacts children who are already immunocompromised becomes very important, and calls for governance the way we strengthening our governance structures in the way we plan, we allocate resources to ensure that no one is left behind. The second thing we have to be cognizant of, and I've seen some of us raise it on the chart, is how other health services are affected anytime we have disease outbreaks. And I want to go back to the childhood immunization because that is one of the things that we are very keen on during the COVID-19 response as Amref, because over 20 million children miss their vaccination doses. And what we are trying to do right now is play catch up. And therefore, moving forward, one of the things we are talking about on the continent is how can we do better? Because it almost feels like outbreaks are here to stay. Disease outbreaks are here to stay at a national level, at a very localized level, cross-border. Just the other day, we had cholera cases being exported from Dar es Salaam to Comoros. So how can we do better? What can we do to be better prepared for this so that anytime we have disease outbreaks, then we don't have to choose between one or the other? And I say this especially in the case of children. How can we ensure that we have more integrated services at the primary healthcare level? Because sometimes it becomes difficult to pull out all your nurses and take them out there to vaccinate for cholera, for example, leaving the other health services that children need to be accessing, adults need to be accessing. So how can we plan better in the way we allocate resources? And the resources is not just the money. It's the medical commodities and supplies. It's in the health workforce. It's in the funding that is required to go out. Because when we have floods, then people get other priorities. When we have droughts, people get other priorities. They move away in search of pasture. How do we ensure that we can continue reaching out to these people through outreaches to ensure that they can access their health services, that these health services are not interrupted? So integration, again, becomes very key, as well as allocating the resources to ensure that all services are being supported adequately and there's equitable access to quality health services. The third one, which all of us, I think, need to reflect on, is around the multi-sectoral response. Florence already talked about the safety net that schools provide in preventing spread of HIV for adolescent girls as well as boys. And therefore, we don't have any stakeholders from some of these sectors that are very closely linked to the work that we are doing in trying to ensure that children can be protected, they can access the services that they need. So multi-sectoral response becomes very important. How are we reaching out to the education sector? How are we reaching out to our stakeholders in the environment sector, in the water sector? If you look at what we have right now on the panel, including the participants that we have. I think most of them are already talking about working for CSOs that are already in the health space. We panelists are also all in the health space. So having a mix of us to really try and come up with solutions in a more broader way, thinking out of the box, thinking about the solutions that the education sector can bring in, the environment, the water people who are very critical, especially when we have floods, to ensure that the children whose immunity is not, might be compromised, are protected, because it's very difficult for them to deal with these diseases anytime we have cases of co-infection. So a multi-sectoral approach also becomes very critical. Last but not least, I think one of us has already alluded to why we need to prepare our communities better, very critical. We go back to our communities because diseases start there, they end there, and therefore ensuring that our communities are prepared becomes very critical. I think we all need to appreciate that we still have quite a bit of knowledge gap in understanding the intersection between all these issues, especially at the community level. So what are we doing to ensure that we can fill that knowledge gap? What kind of evidence are we trying to generate at that level? At what point are we going to say that our communities are ready? So that when these issues happen, they're able to quickly react to that, respond to that. What does readiness look like? And we cannot continue splitting the functions of our community health workers as well as our communities, because we know communities are theme agnostic, for the lack of a better word. They deal with the issues as they come up. They are not biased towards malaria or HIV or TB. They really deal with the issues in a more integrated manner. So how can we ensure that we are approaching them in that way, that the community health promoters we are working with, including the community health workers, understand it in that way, so that when they go to a household, they're not just going for the children, they're also going to try and create awareness about how to better prepare for the impact that the climate change is likely to have on the overall health status in that household, and what to do when these things happen. So an integrated approach at the health system level, at the community level, therefore becomes critical. The last thing I wanted to highlight is the role of the private sector on this. And I say this because I saw us go towards the private sector when we were responding to COVID. We went to the private sector when we wanted lab diagnostics, for example, the rapid diagnostic kits. When we wanted support in R&D, we went to the private sector. When we wanted better systems, then we wanted to learn from the private sector on how they, manage their supply chain, for example. So even as we do this, what kind of solutions are we likely to get from the private sector? How can we bring them on the table, and how can we have that kind of discussion so that it's not too closed room, but we're able to benefit from all the players who are likely to advance this? I submit there. Thank you.
Yeah, thanks, Jackline. You've raised a couple of things, and I think the key word or the key intervention you've raised is around, we've heard about let's have youth-led interventions, let's have women-led interventions. If you brought us back to community-led interventions, communities being the strength of all the work that we do and of the HIV response throughout the world as well. There's a couple of comments in the chat box, and I want to thank participants who are engaging via the chat box. We've got Charles, we've got Lyd, we've got quite a few who are sharing. They're also bringing us back to Jackie's point around, or Jackline's point around community-centered and the roles of health promoters. This has come up throughout the webinars. We do have a question, and I want to see if any of the panelists want to answer, and that's the question from Stuart around peer support and where they can also be used to support eco-anxiety. Now, this is quite an interesting area of the webinar which has come up. So any of the panelists, Gloria, Jackline, Onesmus, Corinna, if you're still there, just unmute and go ahead briefly for 2 minutes.
Hi, Shakira.
Sure, Onesmus, you can go ahead.
Yeah, I think looking at all the intersectionalities and what actually colleagues have talked about, it really boils down into the atrocities that women go through in the face of climate change. I mean, we are seeing increased cases of violence, both domestic and violence against women, especially during migrations. And this is an issue that impacts the sexual reproductive and rights, especially of young girls. And this is basically one of the things that I think as advocates, we need to advocate for to ensure that we limit the negative impacts of climate change on the sexual reproductive health and rights, especially of adolescent girls and young women. Thank you.
Is there any of the other panelists who want to weigh in? We'll give you a minute or two of time.
Can
Okay. Yes, Florence, go for it.
I don't want to pretend I have an answer to Stuart's question. I'm not an adolescent, way far from that. But also, I think I'm just reflecting, listening to the incredible input from both Onesmus and Jackline, and listening and being inspired to think more around health security, because I think sometimes we sit in our HIV cocoon and just think about HIV. But as we are constantly now pushed, particularly by adolescents and young people, to think more around their needs from a person-centered care approach, but also challenged to think primarily from a person-centered care approach, because a person living with HIV is many things. They are just not the disease anymore, and there are so many facets of their lives that go on that would be affected definitely by security. So I look at it as whatever the HIV movement has secured as platforms that could be useful for bringing these conversations, for bringing this level of peer engagements to look at preparedness, to identify mechanisms for building resilience around these potential health crises or threats to security. What top 3 things must you be aware of? And I think having grown in this sector and knowing how much peer support has been involved in keeping me alive and keeping me resilient across different things about just not HIV, but across our lives, I think these mechanisms exist. And I find this as one of the places where we can think about expanding and using those opportunities that are already there to try and create that intersectionality more strongly.
Thank you so much, Florence. I see, Corinna, you've got your hand up, and I want to take that sort of to take us to the closing as well. So over to you for what you'd like to share. And a question to you and all panelists, and post your response, we'll go to other panelists. But what are 2 actions we need to take from this webinar? 2 quick actions. So to you for your response and 2 quick actions.
Okay, well, firstly, I think we all have a lot of strategizing to do. What are the precise policy changes we should be focusing on? Which policy processes should we be engaging in? Who are our allies? How do we equip ourselves with the strategic intelligence on the best way to enter and impact the climate space? So we're at the Coalition are very excited to think through these questions with all of you. And the other point I want to make goes back to building the evidence base. And at the Coalition, we're at the start of our journey. And next year, we intend to create a global policy report on children, HIV, and health in crises. And this will be a platform, a process of consultation, and a broader initiative with all of you to bring together and coalesce around a common advocacy agenda, some policy recommendations. So an invitation to get involved, and you can find out more about our strategy on our website. But I just want to end with the reflection that last year was the all-time high in international aid, and almost $224 billion was spent. And the year before that, 90 billion was spent on climate change. And I'm really excited, and I'm confident that the decades of experience we have in child and adolescent HIV activism can be applied to the climate space. We can ensure that some of these aid flows benefit HIV-affected children and adolescents, and that they shape how they're used. And I'm excited about COP30 in November 2025 in Brazil. And I'm excited about the 55th PCB this December, which has a thematic focus on children. And I think these are all opportunities for us to work towards, and just to call for us all to be ready.
Thanks, Corinna. I was busy multitasking, just saying to panelists that we're having more questions come up in the Q&A section. And so as we start to close off, if you could type in an answer live, that would be wonderful. There's a really a great few questions which are coming through. So, for example, Frederick is talking about, I want to know what are some of the strategies and plan in place to help and reach parents and children living with HIV in remote areas. And that's a really important point you're raising, Frederick, is, you know, the impacts of climate change and climate disasters are even worse on those in remote areas. So I encourage all panelists to answer the Q&A in the actual section live. We're going to shift back to Jackline. Jackline, what are your 2 key actions that you think we need to leave this discussion with?
I think one of the participants is already alluding to that, is integration. And I say integration because the basket is not getting bigger. The priorities are getting bigger. And what we have seen from practice is that anytime we have a disease threat, we start first by vertical programming. And then thereafter, once we have dealt with that, we now go into how can we integrate. We've seen it in COVID. We are seeing big donors like the Global Fund now talk about how can we integrate the big, you know, TB, HIV into, you know, to benefit the broader health system. So can we start with that? Because we have learned we have to do things differently. So how can we, now that we're having this conversation, climate change is a new challenge, not exactly new, but this is when it's come to our realization that we need to address it. How can we have that mindset from the onset and look at how we can integrate so that we don't try other vertical programs on climate change and health and things like that? Let's integrate to ensure that the dollar goes further. That's one. The second one is the multi-sectoral, because I think even stakeholders in the health sector, the governments, the Ministry of Health officials have realized that some of these solutions, problems cannot be dealt within the health sector. And so how can we make multi-sectoral collaboration a reality? Let's try and reach out to the stakeholders in the education sector and see how they can help us push our agenda. And the same thing with the ones in the environment, water, and things like that. So multi-sectoral collaboration is critical. Integration is really going to ensure that we move the needle on this discussion. Thank you.
Jackline, it's really great that you joined us this morning. I'm going to shift to, well, it's morning where I am at least. I'm going to shift to Onesmus. Onesmus, you gave us quite a few points to think about off what you've shared. What are the top 2 takeaways you'd like us to think about?
Yes, I think what I really want.
Okay, we seem to have lost Onesmus slightly, so let's give it a few seconds and see if he returns. Okay, if not, Gloria, I'm going to shift over to you.
Okay, thank you so much, Shakira. And of course, adding on the voice of Csaky, who has talked about integration and multi-sector approach, I want to talk about emergency control policies. We have seen that we have all these policies that are helping in policies and guidelines on HIV services and all that, but we don't have policies that can help us in case of these emergencies or climate change crises. In case there are floodings and all infrastructures are being swept away, hospitals are being swept away, do we have those policies that can help protect the interests of these HIV patients and also the caregivers as well and children? So we need these policies in place and also need them to be implemented. Then lastly, I want to talk about the community engagement. We need to engage the communities and put them at the front line. And I believe we can do this by doing the 3 E's that I always believe in, which is education. We educate them about the impacts of climate change and how best they can come on board to see that they address the challenges of climate crises. Number 2, let's empower them. And number 3, let's equip them with the skills and also knowledge on how best they can preserve the environment, just like I said earlier. And of course, advocacy. We need to integrate climate change and HIV advocacy so that we can address this consecutively. Thank you so much.
Thanks, Gloria. And I'm going to shift over back to Florence. You know, really it's GMP Plus and EPIC who are hosting this discussion and who brought us together for what I think, at least in my opinion, is a really rich discussion. We've touched on various areas from global health governance to the community level. And I wanted to turn back to you to sort of bring this to a close in 1 or 2 minutes. So over to you, Florence.
I think I've learned a lot today. I am inspired, and I hope that we all are, to think more broadly about how climate change and broader health security affects our lives as people living with HIV, and the responsibility we must now then take towards learning more, convening more around these topics, and getting away from just our vertical disease-focused interventions and thinking more and including multi-stakeholder responses as well. It starts from elections, the decisions on who we vote for, what accountability mechanisms we hold our governments in, who's going to school, are they staying in school? So it's broader. Before we get to the HIV, there's a lot that happens into our lives. And I feel like that is the takeaway I have gotten out of this discussion. And I'm really wanting to thank all our panelists today. This is the first time we are having many of you come into GNP Plus. It's not been our usual GNP Plus webinar, I must add. And we are really grateful that you did come to us, and we hope to continue the discussions. It is going to call on us to want to think and broaden our minds. And I think alluded to by Corinna, that we need to strategize more, figure out who else to talk to, bring onto the table, what lessons to learn. And also, where is who leading that we just need to go and follow and support with the infrastructure we've got, so that their leadership is strengthened. And I think those are the things I'm taking away from here, and loving Gloria's end on 3 E's: educate, empower, and equip. And I think GNP Plus has a role in filling the knowledge gap. It is a critical time in the HIV movement. Everyone is engaging at country level to build up to a global HIV sustainability framework development process. This is what will get us the Global AIDS Strategy 2026 to 2030 and all the discussions of HIV response beyond 2030. I think we owe it to ourselves to learn more about this topic, about broader health issues and the security of health for people living with HIV, and take that into the discussions, because our countries are now engaging very directly in developing frameworks for ensuring a responsive and resilient HIV response. I hope we will have more discussions. Thank you for now. And thanks to the team that organized this, our wonderful ladies at EPIC, Anna and Helena, and all of your panelists and everybody who joined and asked questions and engaged and shared with us. Thank you all, and wishing you a great rest of your day and the weekend. Back to you, Shakira.
Florence, you've pretty much done a closing, and so thank you for that. I want to say this is not a webinar. I thought of it as a conversation. I want to thank the participants who stayed on for well over an hour. Many of you have shared very sensitive experiences in the chat box and on the Q&A as well. And I wanted to acknowledge that, because it's not easy to always speak about it, but you've helped us to think about the sensitivities of diagnosis, of treatment. Lots has come out. I took down copious notes as we went throughout this. First and foremostly, thanks to Jackline, Kiarie, Gloria, and Nawanyaga, Corinna, Florence, Riako, Anam, and also Onesmus, Kalama, who I was panelists and took us through the discussion today. We heard lots and lots of things, but for me, I leave you with the thought of let's be youth-led, community-led, women-led. Let's end AIDS by 2030. We started off saying that we've not spoken a lot about this, but there is a sense of urgency which is emerging, at least as the panelists are speaking. And really what was shared is the time is right and the time is now. So I leave you with that. Once again, thanks to GMP Plus and APIC for hosting us, our panelists, and we hope to continue to engage you on this topic and the broader agenda. Bye, everyone. Lovely to connect.